Hello and welcome to Bite-Size MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on immunological pathways and mechanisms.
So let's now have a question and a bit of discussion about the innate immune system. A 28-year-old woman presents with recurrent bacterial infections. Laboratory infections reveal normal levels of immunoglobulins. Neutrophil count is within normal range. The patient has no history of autoimmune diseases. Which of the following innate immune components is most likely impaired? So our options here are natural killer cells, the complement system, pattern recognition receptors, macrophages, toll-like receptor dysregulation. So the correct answer here is the complement system. And this is due to the fact that there are normal levels of immunoglobulins and neutrophil counts. And having deficiency of certain components of the complement system can put you at increased risk of certain bacterial infections. And this will be discussed more in the episode on complement. So let's now discuss this in a question. A 40-year-old man experiences recurrent infections with intracellular pathogens. Immunophenotyping reveals a reduced count of T lymphocytes expressing the CD8 co-receptor. Which aspect of the adaptive immune system is likely compromised, affecting the patient's ability to mount effective responses against intracellular infections? I'll just leave that up for a little bit longer. It's quite a lengthy question. So our options are antibody production, memory T cell formation, cytotoxic T cell activity, B lymphocyte differentiation, or helper T cells. So in this question, it's important to remember the process of adaptive immunity and the steps involved in this. Given that in this case, there is reduced counts of cells expressing the CD8 co-receptor, the correct answer in this case is the cytotoxic T cell activity is most likely affecting the patient's ability to mount an immune response. So let's now do a question. Which of the following statements best describes the underlying pathogenesis of a type 1 hypersensitivity reaction? So these are our options. It is mediated by IgG antibodies. It involves immune complex deposition in tissues. Mast cells and basophils release histamine and other mediators. It has a delayed onset, or it is associated with granulomatous inflammation. So in this case, the correct answer is C, that mast cells and basophils are involved in releasing histamine as well as other mediators, which we spoke about. You can hopefully see why the other answers are wrong, but these answers will all come up as we discuss the other three forms of hypersensitivity, and you will realize, having watched all 4 episodes, that each of these do relate to at least one of the other types.
Okay, so let's do some questions now. A 30-year-old female presents to the clinic with fatigue and shortness of breath. She has recently had a viral respiratory infection. Laboratory investigation reveals a decreased hemoglobin level, and a peripheral blood smear shows evidence of hemolysis. Coombs test is positive for the presence of antibodies bound to red cell. What is the underlying pathogenesis of hemolysis in this patient? So the options that you have been given is A, immune complex deposition in the small blood vessels, B, activation of the complement cascade, C, cross-linking of IgE antibodies on mast cells, D, antibody-mediated destruction of red blood cells, E, granulomatous inflammation. So if you recall earlier, we talked about the fact that if the Coombs test is positive, this is most likely due to the antibody being picked up on the surface of red blood cell. And as a result of this, this is hinting at a type 2 hypersensitivity reaction. Therefore, the correct option in here is going to be option D. So let's do some questions. Question 1. A 45-year-old male with history of chronic hepatitis C infection undergoes treatment with oral amoxicillin for a dental infection. After several weeks of therapy, he develops arthralgia, skin rash, and a palpable purpura on the lower extremities. Laboratory investigations reveal decreased complement levels. Which of the following conditions is most likely responsible for the skin rash and a palpable purpura in this patient involving a type III hypersensitivity reaction? So the options are A. Rheumatoid arthritis, B. Systemic lupus erythematosus, C. Serum sickness, D. Polyarthritis nodosa, E. Goodpasture syndrome. So recall that this is a classic case of somebody with a history of hepatitis that has recently had an infection and required antibiotic treatment and has come up with a classic purpuric rash concerning for a hypersensitivity reaction. And if you remember, as per our discussion, the correct answer in here is going to be serum sickness. So let's do some questions. Question 1. In type 4 hypersensitivity reactions, the primary cells responsible for the observed tissue damage are A. Helper T cells, B. Cytotoxic T cells, C. Regulatory T cells, D. B cells, E. Natural killer cells. If you recall from our discussions earlier, the correct option in here is going to be cytotoxic T cells. Now, let's do some questions. Question 1. Which of the following statement accurately describes the alternative pathway of the complement system? A. It's primarily initiated by antigen-antibody complexes. B. It is involved in the opsonization of pathogens. C. It requires the presence of antibodies for activation. D. It is independent of antibodies and can be activated directly by microbial surfaces. E. It leads to the formation of the membrane attack complex or MAC only. So now the correct answer in here is option D, which is that it is independent of antibodies and can be activated directly by microbial surfaces. Recall that it is a classic pathway that has any effects on antibodies or antigens, and the alternative pathway is indeed directed by microbial surfaces. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.